Hello, I'm Dr. Alan Beyer, Executive Medical Director of Hoag Orthopedic Institute. You may also know me from my weekly radio broadcast, Doctor in the Dugout. But today we're on video, and we're joined by one of our new partners and associates at Hoag Orthopedic Institute and Newport Orthopedic Institute, our practice. His name is Omar Yaldo, and he's a specialist in foot and ankle surgery. Omar, thanks so much for being here with us today.
Thank you for having me. It's my pleasure.
So whenever we have a new guest on the show, I always like to start off by giving him or her the opportunity to tell us a little bit about where you grew up, where you went to school, how you chose orthopedic surgery, how you wound up out here. So go ahead. The microphone and the camera are yours.
Excellent. Well, I grew up in the Metro Detroit area, spent my whole childhood there, went to school at a school called Oakland University, which is in Michigan and not in California. And then I did my medical school there. I did my residency in Western Michigan in Grand Rapids. And then I did my fellowship training in Pittsburgh, and I ended up in California.
So was it always a desire to end up in sunny Southern California?
It was. I definitely am not built for the Midwest, and my family lived in California before they moved to Michigan, but I wasn't born yet.
So we're seeing an increasing percentage now of young graduates who finish their residency and don't go directly into practice, but choose to do a specialty, an extra year of subspecialization in a different field in orthopedics. You chose foot and ankle surgery. Tell us a little about what drove that decision.
Yeah, the foot and ankle is a complex arena. There's 28 bones, 35 joints, ligaments, tendons, nerves, and arteries. And the cool thing is one day I can be an arthroplasty surgeon, much as yourself, and the next day I can be a trauma surgeon fixing fractures. I can be a sports surgeon and do some arthroscopic surgeries, and I get to see a broad variety of patients, whether it's someone who's maybe getting elderly and developing arthritis, or it's a young athlete with a sports injury, or even someone that's very young that has a congenital defect or has fractures as well.
You know, foot and ankle injuries seem to be a very large part of the musculoskeletal injuries that we see patients for across the board in the emergency room and in our office. As a matter of fact, we're filming today's episode during the NFL playoffs, and we're just seeing an absolute epidemic of what's called high ankle sprains. Let's keep it a little bit relevant to the times. Tell our audience what is a high ankle sprain and what differs it from the garden variety, rolling your ankle when you're playing basketball and having a good old-fashioned ankle sprain.
Yeah, we see high ankle sprains a lot in football as a result of cleat wear, as a result of artificial turf surfaces, and it is a rotational injury. The difference being the ligaments involved are the ligaments that hold the tibia and the fibula together. So you end up having pain more so in the lower leg than necessarily the side of the ankle as a typical ankle sprain. And it can be very hard to do cutting, jumping, high impact movements when you have a high ankle sprain that hasn't yet healed.
So what makes the determination between a high ankle sprain that requires surgery almost emergently, like Tony Pollard, who plays for the Dallas Cowboys a few weeks ago, versus a high ankle sprain that Patrick Mahomes, the quarterback of the Kansas City Chiefs, sustained a week ago and then played 8 days later without surgery?
So Tony Pollard also had a fracture as part of his injury pattern, so that necessitates surgery. But another example is Tua Tagovailoa or Kenny Pickett had syndesmotic ligament ruptures. So a high ankle sprain has multiple grades, the highest grade of which is complete ligamentous rupture, where the ligament is no longer or is compromised and doesn't have the ability to then heal. Whereas if the ligament is stretched or bruised, it has the propensity to heal. And really, one of the only ways to tell that is with a stress X-ray examination or with an MRI.
So we're sitting here today at the TV studios at Laguna Woods, a very active senior population. Many pickleball players, many former tennis players have morphed to pickleball, not just at Laguna Woods. That seems to be a phenomenon that's sweeping the country. Pickleball, in my experience, is not no injury ball. There's a lot of injuries with pickleball, and a lot of those injuries tend to be foot and ankle injuries. Tell us a little bit about the injuries that are specific to pickleball, and then I'm going to follow that up and ask you what people can do about them before they have to seek out your services. So let's talk pickleball ankles.
Yeah, the most devastating injury I see from pickleball is Achilles tendon ruptures. And as we age and we maintain being athletes, our calves can get tighter, or we can have underlying Achilles tendon disease, tendinopathies. And the biggest thing is to just make sure you're appropriately stretching before engaging in activity, but also just stretching on a daily basis to make sure you stay limber and protect that Achilles tendon. I see a lot of ankle sprains from pickleball, and really the catching those early and seeking treatment to make sure you re-strengthen your ankle and regain your stability before going back and playing to prevent a sprain from becoming multiple sprains and chronic instability. And the other things I see are just from a jumping and diving and falling awkwardly. I see some types of foot fractures every once in a while, and there's not much you can do to prevent against those other than making sure you're wearing good protective shoes and taking your vitamin D and calcium.
So there's a couple of things I want to unpack there because they're really valuable to the people who are listening today. First of all, you alluded to shoe wear. Pickleball is not a sport that's meant to be played in Birkenstocks. I mean, there are specific court shoes that people should wear for pickleball to try to prevent some of these foot and ankle injuries that you're talking about. What do you advise people on that?
Yeah, I think the pickleball specific shoes work for the sport. I think it's important that your foot appropriately fits those shoes. And if you have a wider foot, for instance, you can have your metatarsal hanging off of the plate of the shoe, and that puts you at risk for something like a fifth metatarsal type fracture if you land on the side of your foot, for instance. So making sure it's the right shoe for the sport, making sure it's fitted appropriately are the two biggest things you can do.
So then let's go to the stretching part. Again, we're dealing with a population, especially here at Laguna Woods, which is a senior population. I've always told people the older they get, the more important stretching gets, and strengthening becomes kind of almost secondary. Stretching before they play, even though I don't heed my own advice and tend to go to the first tee sometimes without having stretched, is very important, especially for an explosive sport like pickleball, as opposed to golf, which is somewhat less explosive. I mean, what kind of stretching regimen do you recommend for people?
I definitely recommend stretching your posterior kinetic chain, your calf muscles, your hamstrings. You can also stretch your quads. I would recommend doing all of those before going and playing.
So then the last thing I'm going to ask you is that age-old question that always haunts people is, okay, I injured my foot or my ankle playing pickleball. How do I know which is the one that I need to go to urgent care or to the emergency room for? Or how do I know if it's the one that I can stay home, ice, elevate, compress, rest, the typical RICE modalities that we always tell people about? What's the determining influence for who needs to get in the car and go and see a professional?
Certainly the inability to bear weight, the inability to put weight and walk on the injured side, for me, warrants investigation, warrants a good examination and evaluation. Typically, worse injuries have more swelling and bruising. That's not an ultimate sign of needing to get checked out, but if you're pretty significantly swollen and bruised, I think it's worth getting a set of x-rays and making sure nothing is going on.
So basically, bearing weight is the key one that you think to. If you can put weight on it, it can probably wait a couple of days and see how it does. If you can't bear weight, maybe you should make that trip to urgent care or to the emergency room immediately.
I think that's a good indicator. And again, some people have different pain level thresholds, and I've seen people walking on fractures, certainly. But if it's hurting you when you're walking, you should get it looked at. And if it's not getting better over the course of a few days, that's another reason to go get checked out.
So let's talk about a couple of other things that fall within your subspecialty, certainly which affect people in the age group that we're talking about here again. Bunions. Bunions, an age-old question. Do I have them fixed? Do I not have them fixed? Is it cosmetic? Is it functional? Give us a little 5-minute primer on bunions and what needs to be done.
Yeah, I think the important thing and some of the misconceptions with bunions is that it's not a lump of extra bone, it's an actual foot deformity where a bone is shifting in the foot, causing the foot to be wider and changing some of the dynamics of the foot, causing you to put more pressure on the ends of the lesser toes or the ball of the foot. So I see a lot of people with bunion pain, either having pain over the inside of the bunion where it rubs on shoes, or having pain in the ball of their foot because a lot of the forces get transferred to that area. I think that's an important thing to understand. I think when you're looking at bunions, every bunion is a little bit different, and it's important to understand the concomitant things going on in the rest of the foot. For instance, a bunion in a flat foot is very different than someone that is born with a bunion or someone that has a bunion in a high arch foot. And it's important to have a surgeon that understands that and that takes that into account if you are going to proceed with having your bunion operated on. As far as conservative managements for bunions go, I have never seen something like braces for the teeth correct a deformity. There are certainly a lot of over-the-counter devices that can pad an area to help with some of the pain that comes over the bump. There are toe spacers and things that can prevent the big toe from pushing into the lesser toes. And there are shoes with wider toe boxes, things such as Hoka's or Ultras, ALTRA, that have a wider toe box that can be more comfortable for shoe wear.
Another question I get a lot from people here, and not all of this really falls into your expertise, but at least I'm sure you've got some sage advice, and that's neuropathy, which seems to affect a lot of people as they get older. And let's tie that a little bit to diabetes, which actually also affects a lot of people as they get older. Dispel some of the myths and give us a little advice to this population, how they should deal with neuropathy, and explain a little bit what it is and what they need to do about their diabetes and their feet.
Excellent, yes. So diabetes is a vascular disease, and the blood vessels that are the smallest typically get affected first. And some of those vessels are the vessels to the peripheral nerves. So it is not inherently a nerve disease, it is a vascular disease that ends up affecting the nerves. And what can happen is neuropathy can present in many different types of ways. It can present with numbness and tingling. It can present with pain. And we talk about a stocking and glove distribution of pain that can happen with peripheral neuropathy. The important things for in general with neuropathy are at least trying to find an underlying cause, because if it's something like a vitamin B12 insufficiency, that can actually be reversed. Whereas if there's permanent nerve damage from the vessels being clogged with diabetes, or from something like having taken a chemotherapeutic agent, or if it's idiopathic neuropathy and we just don't have a cause and it's undiagnosable, the important thing to do is to protect yourself. And for a lot of my diabetic patients who have lost protective sensation of their feet, it's important to wear good cushion supportive shoes, sometimes even custom diabetic shoes.
So Omar, how important is it to you after finishing your fellowship and becoming a foot and ankle specialist, was it to gravitate to a center like Hoag Orthopedic Institute and Newport Orthopedics, where we have the subspecialists, we have at a community hospital the level of care that some people are used to seeing only at an academic institution. How important was it to you to choose a place to ply your trade, so to speak, where the quality of care was really a lot higher than one would expect to see at a community hospital, and gets rid of the need for people to kind of out-migrate to get these problems taken care of? They've got world-class orthopedic care right at home.
I think that's of the utmost importance. A lot of what I deal with, as you mentioned, things like diabetes, things like vascular issues, you want to have a team coordinated effort. Even within your orthopedic care, if someone has both ankle arthritis and knee arthritis, it's important to have a game plan of which surgery comes first, how do we time these, and how do we appropriately manage this patient together with a team in place. And a lot of patients require some sort of ancillary services. So having Hoag that has even some specialized physical therapy, such as things like lymphedema therapy, it's very important to be a part of a center that provides high quality care across the board.
So how are you spending your extra free time hours, not that you have that many, that you're new to practice, new to Orange County? What does Omar do to blow off steam at the end of a busy day?
So I like going to my local gym and getting a good workout in and trying to keep myself as healthy as I can. And then I like exploring some of the different restaurants. I like exploring some of the different views and scenes, places like Crystal Cove, places like the Peninsula, and just seeing all that Orange County has to offer.
Well, thanks for coming and being part of Newport Orthopedics and Hoag Orthopedic Institute. Thanks for being here today. And that kind of wraps it up for us here today. I hope you've learned a little bit about treatment of foot and ankle and what's available to us in this area. Certainly you can reach out to Hoag Orthopedic Institute and to Newport Orthopedics with any questions you might have, any inquiries for Dr. Yaldo, and he'll be happy to handle them. Thanks for listening today. And as always, we're the experts at getting you back to you. See you soon.